That's on and off switches for me.
No relatives, I have a lot of good friends.
We go to that Walkers down there all the time.
I go to Chicago. Boston, Greek Island, best in the world.
Oh, really?
The atmosphere, the food, the service, whatever. Detroit doesn't.
You're with us. Yeah. So she's still looking for Lori, then. Really nuts.
Turn your phone off.
I get it.
Yeah.
I didn't turn it off, I just turned the sound off.
It's 3:30. I'd like to call the Ways and Means Committee meeting to the May 3rd, 2012 to order, please.
Commissioner Collins?
Here.
Commissioner Cross?
Here.
Commissioner Darazinski?
Here.
Commissioner Engel?
Here.
Commissioner Jaeger?
Here.
Commissioner Longmire?
Present.
Commissioner Mahoney?
Here.
Commissioner Plummer?
Here.
Commissioner Skolnick?
Here.
Commissioner Snyder?
Here.
Commissioner Wilkins?
Here.
Thank you. Approval of the minutes of April 17th, 2012.
So moved. Second.
It's been moved and seconded. Any corrections? Seeing none, all in favor say yes.
Yes.
All opposed say no. Minutes are approved. Public comment on agenda item. If there's anyone in the audience who'd like to address the board today on an agenda item, please come forward. Moving on to items for consideration. WM 12/05-58 from administration.
So moved. Second.
That's been moved and seconded. Questions, comments? All in favor say yes.
Yes.
All against say no. That motion carries. WM 12/5-59 from administration.
So moved.
Second.
That's been moved and seconded. Discussion, Mr. Mahoney, Mr. Jaeger. Mr. Mahoney.
Heath, you want to give us a little brief update on the balance sheet that you've appreciate it.
Sure.
Keith Kaplan, Finance Management Services Director. I thought I also handed in front of each of you a paper copy of the balance sheet that I'm going to walk you through from A to Z. And please stop me along the way if there is any questions or something is completely unclear as to how we did it. With Brookhaven and its condition as of September 30th, 2011, the first thing that was the most apparent was that the allocation from the general fund would have to be increased to be able to balance the activities for the fiscal year. And when you see that activity, you'll see down at the very bottom right-hand corner of the balance sheet that's prepared, $940,103. That's the amount that was appropriated as of September 30th of 2011 to balance the year, close the books, get everything ready for presentation of the audit to this body here. Because we can't assume as accountants that the governing body is going to approve a loan, approve any transaction. So we just want to get it to that balance state and then present the rest to the body. And that is the following. When you work at the columns, you'll see at the very top of that balance sheet the columns from A to L. We're going to work our way from left to right across it. And you're going to see every step of the way of everything we had to do to get everything into what we call a normal financial condition. So the first thing, when you look at all the categories in column A, I'm going to start in B. The first thing that was the most obvious for us to start looking at was the classification of the fund as a special revenue fund. Brookhaven has been classified as a special revenue fund historically. But however, when you look up the definitions of use through the Michigan State Uniform Chart of Accounts, you'll see it's more suitable under a medical care facility, which belongs in an enterprise fund. And so when we start the audit and you start, it's not just you just hand a trial balance over to the auditors and you say, okay, I'll see you in a couple weeks. It's a partnership side by side with the county. We walk them through our financial statements. It's the ones we prepared. Their jobs of auditors is to verify the accuracy of those numbers. And so as we walk through, the first thing we jointly went through is that we knew GASB 54 was going to be applicable this year. And the reason why Brookhaven came to light under a GASB 54 ruling is because anything that is a governmental special revenue fund, GASB 54 would apply. And we'll get more into what GASB 54 means, but that's what started us down this path of really analyzing and scrutinizing the financial statements of Brookhaven. Then, once we determined and agreed that really it should have been an enterprise fund, we have migrated it to an enterprise fund. So you'll see from column B at the top to column D. Okay. Now, in between there, you'll see the GASB 54 adjusting entry that was made to transfer those net assets, those inventory assets over to the balance sheet of the enterprise fund now, which is now Brookhaven as well. And the good news with it being an enterprise fund is we get to carry over, as you can see before, in a governmental special revenue fund, we didn't show those same assets. Again, county rules. But with an enterprise fund, you can show those assets. And again, that's a GASB 34 statement if you're curious as to all these little acronyms about fixed assets. But that was the positive. As you can see, we picked up assets by making that transaction. So the net benefit, you'll see by obviously taking the pluses and minuses, the debits and the credits, you'll see that we picked up some significant net assets by doing that. Okay? Does everyone follow me so far? So I'll make sure I'm not going completely off base here. All right. So now that we got column D and we're an enterprise fund, the first thing that's most apparent, at least to us financially speaking, is the negative cash.
Can I just ask, there's sort of a dark spot in that. Is there a reason?
Right here you're talking?
No.
Shade. I guess I don't see it.
Yeah, your piece of paper is in the shade. Your piece of paper that you got on there is in the shade.
Do you see mine shaking?
I can see the shade from here. There we
That any
go.
better?
That's better.
I'm sorry, I guess I didn't.
Yeah.
Well, you can adjust the lamp.
Just the light.
Yeah, well, I rarely use it. The light, that is. Okay, sorry about that.
I'm
Yes, sir.
sorry, I'm familiar with GASB and what that's doing. Allowances, help me with that. What are you going to get into that?
Yeah, that's actually my next step.
Okay.
But first, I want to point you to the negative cash, the most obvious symptom of the fund. You've seen that negative around $2.7 million. Normally, that wouldn't be very alarming because as you work your way down the balance sheet, and you'll see that obviously we had enough assets to cover any negative cash we had. So anytime we have that, we're okay. I'm not saying we're great, we're okay. We don't have to follow a deficit elimination plan with the state. We have enough to operate. And so there was nothing alarming in column D. So I just wanted to show you that conversion from going from special revenue fund over to an enterprise fund and the pickup of those additional assets from the GASB 34 statement that you'll see that come with it. Okay? So now getting to the allowance question you have, Commissioner Jarenzinski, in column E. When you work your way back to column B, you see the net AR, accounts receivable. That doubtful allowance was $188,878. Now, as again, this partnership of the county and the auditors started combing through those receivables, you see a lot that's 120 days and beyond. Very doubtful it's going to be collected. And so we, side by side, worked with Brookhaven officials to make sure that we were agreeing to the same numbers. And we came up with numbers that even, again, we agree with Brookhaven, we have to bring those same numbers to our auditors and show them how we came up with our numbers, the rationale behind it. It's just, we don't pull numbers out of the sky. It's just, you have to be able to justify it on a financial statement before an auditor will give you an unqualified opinion.
These are numbers that are really uncollectible. We have accumulated numbers we haven't written off.
It's bad debt.
Should,
Yep.
as over the years, you should be keeping up on that.
Every year you should be writing off the
But
section.
they're accumulating because
correct.
this hasn't been done.
That's correct. That's correct.
And Keith, I think everybody needs, and I know what GASB is, and I don't know if everybody else does, but it's a model that they're forcing government going from a cash, we got this much money, we got this much cash. If you were a business, you would know what your assets are, and they force government to follow the business profile.
That's correct. Ever since the Enron.
And so all of a sudden,
Collapse.
depreciation and assets come into the picture. And they haven't been worked in before, and now we are catching up on that.
Correct.
Is that
That's a fair
clarification?
Fair clarification. But as you see, we had to really significantly kick up that doubtful allowance from the $188,000 you see up to $1 million. Now, this is the significant piece. As you'll see, this is like a domino. Is as way up here, as we right here, we're working here and we're gonna work our way down. That's why I got these two shaded areas here in dark. Is it immediately kicks the entire fund into a deficit condition. You got negative cash, you got negative net assets, you got negative working capital. That's as bad as it gets right there. That's bankruptcy. Okay, that's you can't have that. You follow a deficit elimination plan with the state. You give them monthly reports. It is a very, very unpleasant process, and it's meant to be. I mean, the state's doing their job to make sure that we are bringing that fund back into a positive financial condition. And so this is one reason why we didn't want to file a deficit elimination plan, one. But two, obviously, it does harm the credit rating of the county. And three, it does delay any future bondings. It would have to be pre-approved by the state. So, any questions with the doubtful collections being upgraded from the 188 up to $1 million? Okay.
I'm sorry, I didn't mean that. Going to the accumulated depreciation, that number is grabbed from, I mean, that's a significant number also.
Correct. Yeah, our depreciation schedule, again, going back to your fixed asset schedule, and you go back to your capitalization threshold, everything that's at that threshold and above is what you're showing that depreciation schedule, and depends on the useful life of that asset. You know, that's the net value of it on this fiscal year.
And this is basically land, bricks and mortar?
That's correct. And there's equipment as well. And again, equipment's not, obviously doesn't have useful life as land, land or building. But however, it's all inclusive. That's an aggregate.
I see it as a fictitious number, but you gotta have it.
You're correct. It is a non-cash transaction. But however, you have to show again how you depreciate your assets. Again, per GASB, is you want to make sure you're presenting a fair, accurate depiction of your financial condition. Is if your assets are depreciating and you're not reinvesting into those assets, it would show you a net effect that would come in the future if you don't.
Ethan, I'm not being critical.
Oh, I know.
I'm just trying to
You're absolutely correct.
get a feel for what it really means.
Absolutely. It's a non-cash entry. That's correct.
Okay, thank you.
You're welcome. So now, the first question is, what do we do? Now that we're in this deficit condition, how do we pull out of it? The first bit of luck, so to speak, that we had is, if you look back in the lower right-hand corner of that summary again, we identified an old reservation that was on the books from the Public Improvement Fund in the tune of $330,000. And where it came from was the airport, when it was first built, I believe in the 1995, 96 era, around that time, if I remember right, when I looked at the entry. The rebuild. There was a reservation put on there to extend the runway. And this was the amount of that extension. And it sat on the books year after year after year after year. And so the question was posed and answered by the administration of the airport and by obviously the Director of Community Services. And they felt that reservation was no longer needed and should expire. And so since we removed the we expired that reservation, we had that 330 that was available that wasn't prior, and we used it in the proposal under column G. You'll see how it comes in. You see how it flows down. And again, if we can knock out this negative 302,391, that's our first step. Okay. As you can see, we're going from negative to positive. Okay. We're at 27,309. Again, not gangbusters, but again, it's positive. Okay. Next step, we got to deal with this negative cash. And the way we're dealing with the negative cash, where we get to our figure of the 2.3 million, is in two categories. Even though we're positive here, you'll see we're still negative in our working capital. We want to bring that up to a positive, at least bring it to an even point. So that's where this $493,000 figure came from. Then obviously, you'll see at the very top, you want to make sure that we're getting rid of that negative cash of 1.8 million and have a little bit in the bank, a little bit positive. And so that's how we came up with the 1.8 million and some change. And obviously, as you can see, from top to down, we go from negative 2.7 million to positive 5,000 and some change with a very positive, balanced financial sheet, and fair and accurate at that. And so these are all the transaction rationale that we ran through in putting together the proposal for this board to consider. What questions do you have?
Going to column E, and I see the math works, but I don't understand. I see the AR adjustment allowance of 811. Where did that number come from?
Again, that was the number that we came up with accounting and working with the Brookhaven staff to be able to, we went through each of those aging categories on the AR report for Brookhaven.
Okay, and then when I carry that down and move over from E to F, I take it the 121 positive and the 811 negative gives us the negative balance of the 689.
Well,
Am I reading that right?
yeah, well, actually, what you want to do with this particular balance is you're taking this 811, 122 plus the 188 to come up with a negative 1 million. So you just,
okay.
this
Okay.
one,
I'm going wrong. Okay.
you carry over to the right.
Why don't you go back a little bit?
1, 2, 3. Haven't seen that since 1981. I graduated high school that year, by the way.
Okay, but let's go to the question that's still not clear in
Sure,
my mind.
sure.
And I'm going down to the fund balance toward the bottom of the page. We got the 811, 122, and then I see a negative of 689, 979.
Right. That's
the difference between the 121 and the 811?
That's correct. That's the effect of upgrading that doubtful allowance up to that $1 million. And as it carries down the financial sheet, you'll see how it cascades across the net assets and the working capital. Well, I see what you're doing. You're taking this 811 and you're carrying it over this way, correct?
Yes, I am.
Okay. And again, I see what you're doing, but again, what's relating to our...
Tell me what if my thinking's wrong there. So.
Right. Again, take your 1 million. I'm trying not to get my fingers too much in the way here. I'm trying to point them all out.
Yeah.
Right. Now, if you get your 1 million here, And as it comes across your financial statement, and by the way, here's your net positive of what you picked up from your GASB 34 net assets. Keep working your way down. And again, the 121, just to clarify where this 121 is coming from, is this was the fund balance that was reserved prior to the end of the fiscal year. And so carrying that forward, and again, once you hit it with you upgrade your doubtful allowance, is really, that's a fictitious number, so to speak. It was not positive. And so that's what happened here. Is you look here at a positive 121,000, you're thinking you got $121,000 in the bank. And realistically, you don't once you take care of your receivables, and that's what we're trying to depict in this column here. This is your realistic number once you take care of your doubtful allowance.
This took you some time.
A little bit.
And our auditors, I don't think Berkeley is doing this.
Ream.
They have seen this.
They have.
They have worked with you on it.
This is a fully audited statement.
Okay. Bob, I'm impressed. That's to be done. Should have been done years ago, correct?
Yes, sir. Any other questions? Clarifications? Yes, sir.
Well, this goes back to a prior discussion. We've solved the problem in the short run. What are we doing to make sure that we don't run into this again? What are we doing to upgrade the collection system? What are we doing to upgrade the manner in which we deal with the incoming patients and all of those things? And I understand that those are being addressed. And I guess maybe if it's agreeable with everyone, I'd like to suspend the rules and ask Mr. Rosenfeld to address that if that's agreeable with everyone. And
I think that.
In favor of suspending rules, say aye.
Aye.
Opposed?
Thank you, Commissioner Snyder and Commissioners.
Before we start, congratulations, Marty, for the great survey result at Brookhaven. My understanding it's the first time in 26 years that we came out without any penalties.
Well, we had 6 citations. They all were lower level citations. And 26 years to those who are still around to remember that far back. They may be longer, I don't know.
I should have never said it.
Well,
I don't remember.
Well, you don't remember, but I've got staff there that was there long enough to remember. They've never enjoyed a outcome like we had. So I'm very proud of Brookhaven staff. And I think that was the precursor to what's going to come, Commissioner Snyder, and in response on the commissioners to your questions, that there is opportunity there, that we know we can do things right. We know we can deal with the state. We know that we can have a relationship with the state that will be far less fractious than it had been in the past, and actually have a cooperative, almost a consultative relationship to the degree they can. That doesn't solve the financial problems. That's the operational side. That doesn't bring us in patients, but it helps, because when the word gets out that Brookhaven is now, instead of a 1-star quality, a 2 or a 3 or a 4-star quality, that helps to make people more comfortable about bringing their family to Brookhaven. So that helps in marketing the facility. We've made a lot of strides in cost reduction, cost control that will help certainly to generate the funds to repay the loan from the county. My initial assessment, based on some staffing changes that we've made and some operational changes, cost savings just in changing the type of pads that we use under the residents and the volume of pads. We can save almost $40,000 a year just on pads. But staffing changes and improvements, not using outside services contract services, my estimate right now is about $700,000 in cuts that will not affect the quality of the service that we are able to provide. Heath and I have been working in other areas to look at food costs, to look at costs per meal. I visited other facilities to see how they're doing it, to learn from them. But we need to get our census up. And the previous surveys are devastating because they, I think in 2 years there were 2 surveys where we were not able to admit patients for, it was around 6 months. We could admit them, but they would pay for it. So to me, that's the same thing. We don't have that sword of Damocles hanging over our heads any longer. We don't have any fines to pay to the state. Every time we would have a survey, we'd end up paying the federal government money in this civil money penalties. We don't have that. So all of it, I think, is very positive. We've got a much better attitude on the part of the staff. I think they feel that there's a lot more that we can do. But right now, I'm focusing on generating new residents and long-term residents. Now, we are getting a lot of rehab patients in, and it's Medicare, and it's about twice the per diem that we get from Medicaid, but in a month they're gone. That's what you want, but it's also what you don't want. You want the long-term care. You want the Medicaid. That's what we're there for. And that's what we're going to be marketing as this is, I'm sorry, I was just at the Macomb County facility. This is Muskegon County's jewel for long-term care, for Medicaid, for those that can't go anywhere else. That's what we're there for. And we get our Medicaid census up to the 180, 185, with 10 or 15 Medicare, we'll do fine. But it's going to take a while to get up there. And that's my focus right now. I can't, I don't want to predict when it'll happen, but I think given the events that have occurred in the last 5 months, almost 6 months since I've been there, there's a lot of hope. And I hope you have the same hope for Brookhaven and will continue to support us as we evolve. And when I first got here, one of the things I said was, someday I want to be a tenant. Now my staff all got nervous. They thought we were no longer going to be county employees. I said, no, that's not what we're doing. We want basically to pay rent for our building and not get the maintenance of effort, not need to get that. That's my goal.
And I understand that you are looking at coding and you're looking at billing processes.
Yes.
And all the
Yes,
intake
we hire an
processes
outside
as
billing
well.
service, correct. We're looking at improving the MDS. MDS is called that's the minimum data set. That's a requirement. Even though it's just for Medicare, by law, we have to have everyone coded under this minimum data set. And that ensures that you maximize your revenues. So we looked at that. We've sent our MDS coordinators to training so that they're doing a better job of upcoding as much as possible and keeping everything legal. Because we don't want to have an audit where they come back and say, well, you upcoded too much, you owe us money. We just had our last Medicare audit that was certified by the feds, and we owe no money and they owe us no money. So that's exactly what I want.
Good, thank you.
You're welcome.
Yeah, I got a couple questions. Do you see the time frame you can come back and give us an update of how this is improving in another 6 months or something like that?
Well, I stand ready to come back anytime you want me to give you the information that you need. But I think I told Administrator Hammersley when I first started that it's going to take me at least a year to get really to understand how it is all working and to get it working the way I think it should. And I'm a little ahead of schedule in terms of the success with the survey, which was really my first priority to reestablish the bona fides of this facility with the surveyors that would come in. So I think we've done that. I would say we can certainly look at September for an updated report, and then towards the end of the year, or the beginning of the fiscal year, which is October, at least to give you an idea of where the progress that we have made. I see this as a 2-year process, to be honest with
Do you see like, are you getting all the help from the county and community mental health that you can possibly need to help you with doing this?
I'm having extraordinarily good relations with the county. I mean, wherever I need help, I'm getting it.
And everybody's working for
Everybody's, I think we're all on the same page and we all want the same thing. And I couldn't ask for more, a better working relationship than I've had.
I had heard that the local hospitals don't refer people to Brookhaven, but do we have a way to get information out to other hospitals, even to Grand Rapids and things like that?
Oh, sure. We just had a meeting this morning. I don't mean to interrupt you, but
Yeah, I want you to.
one of the advantages that some of the other county facilities enjoy, and Ingham was one, and Heath and I went to visit on Friday, and Macomb County, which is the Martha T. Berry facility, they don't have the competition from the hospitals that we have. And the hospitals are a business, and they've established nursing homes, and they want the patients just as much as I want them. So this morning I had an hour marketing meeting with my marketing and admitting staff, and we talked about ways to get the Brookhaven name out, so that the first thing someone thinks about when they got to send mom or dad or themselves to a nursing home or rehab facility is Brookhaven. It just comes right out of their hard drive somehow. And you do that by constantly reinforcing the name of Brookhaven. Even these little lanyards, it's got our name on it. Why? Because it's part of the image. It's the brand. So I think brand building, brand management will all help to do that. And I think I said this once before, I look at the hospitals or anybody else who owns a nursing home, they're my competitor, and I'm out to beat them.
Very good. One more question. Do you see like cuts coming from Medicaid and Medicare as our year goes by? They can happen right in the middle of the year. Can you get allowed for this? And like,
We have to plan for that. Yes, there will be some cuts. I don't think they'll be as draconian as some are predicting, because you talk about a hot political button. Anytime you deal with Medicare, you're dealing with a very, very sensitive issue politically for anybody, and they can talk about it, but they've been predicting 20 and 30% cuts for the last 10 years. And it just has never happened because it's just not necessary. And there's other ways for that fund to build itself up. My problem is not helping Medicare build itself up. My problem is ensuring that I'm able to react to the changes in the fee schedules. I don't know what they're going to be, but we'll adjust with that.
I want to thank both of you very, very much.
Thank you, Commissioner.
I just want to make a comment. I think some of you know that I was involved with visiting nurses in hospice for many years. I was chairman and president of their board, and for many years, of course, Hackley Hospital was a freestanding hospital, and it did not own a nursing home. And I remember even with just visiting nurses, the referral piece that Murray is sort of downplaying, and I don't have to downplay it, but didn't really say much about it, is a huge part of the census in a nursing home. And we have numbers on where the patients go if they have to go to a nursing home. And they're getting the lion's share of them by far. They own Trinity. When I say they, I'm talking Trinity. And I'm sure they're fine nursing homes, but that's a problem. And when we had an independent hospital that really had no motive other than referring people to the best place they could, the best place that was available, I think it was a more even playing field. I don't know what can be done about it. I mean, the hospital, it is a business, as Chris said, but that's part of the problem because that's all happened in the last few years. And that's part of the problem with the census. And is it fair? I don't think so, but it's the way it is. So, that's all.
Oh, yes. I'd like to ask Heath a question. Heath, you said that from your experience, you found that anything 120 days, it almost ends up as being an uncollectible. So are you gonna change that as you get there and see them coming up to 120 days? Will you be writing them off faster, I guess?
Well, as a point of clarification, I don't have the authorization to write off anything. Only this body here has that authority to do so. But to give you just a little, and then by the way, that's a great question. The dynamic of what we're going to need to deal with is to compare real quickly Brookhaven to Community Mental Health, CMH. They have an avatar system that is billing and being able to maintain their medical billing from a financial perspective. They know up front what part of an item that's billed, of what's the true collectible. Okay, their system does that for them. And then that true collectible item is what shows as a receivable AR balance in the Banner system. However, in Brookhaven, in comparison, has the Keen software that does not do that. It's an Achilles heel, of course. So instead of having the actual true balance on the Banner AR, you're seeing the actual billed balance that's on the AR. That's a big difference. Anytime we go to the doctor, you look at the Blue Cross bill or now your Priority Health bill. You know what's billed and you know what's paid, okay? Because there's discounts in there, there's agreements. That portion that's the end that's actually paid is what should be on our AR, not what's actually billed. And that's what happened here.
Yes. Pete, can we upgrade that system?
Absolutely. Now, if
Relatively quickly?
I'll defer that to Marty because I think he can address that.
We are looking at transforming the way our records are maintained by going to an electronic medical record. And as part of that system, there's a billing software, an accounting package, and a front office package, as they call it, that uses the same database so that when your residents are admitted, it starts the whole system geared towards maintaining the cost and the billing and the medical record. So you've got a complete picture, financial as well as clinical, of that resident. And we looked at a few. I'm going to Lansing at the end of the month. The Aging Services of Michigan is having their annual show, and there are going to be some vendors there. But we pretty much selected the vendor that we will probably go with. I don't want to reveal it yet because I get a couple that present to you. But yes, it will give us the information more quickly. And we are implementing new policies too, Commissioner, on the whole idea of collections. And I don't want these to get them. There's a fair amount of that I think we can collect. About 60% of the over 150s, which is $1.4 million, about 60% of that is patient pay and private pay. Pretty good chance you won't get a lot of that. But a lot of it is Medicaid, and it just hasn't been collected yet. So we can probably get a fair amount of that in the next few months to help reduce that over 150. But I don't want it to get that way. And obviously, when it gets to a point, I'll come here and say, okay, we'd like to write off X dollars because chances of getting it, we've tried this, we've tried that. You can't get blood out of a turnip. You can't get dollars out of someone who doesn't have any. So the reality of accounts payable, accounts receivable management are such that you try to capture them early, either get them collected or turn them over. Once they turn them over, then it's up to my collector to get what he can. I turned them over. And that's also going to be part of the process, which we haven't done in the past. And you know, there's some political ramifications to that, and you have to do it gently sometimes, but still, they owe us the money, and they signed an agreement, they being the resident or their family, the responsible parties, and all of that process has to be adhered to. And we don't have this problem. Does that answer your question, Commissioner?
I just want to thank Marty and Keith both for their efforts. This is a process that needed to be done some time ago, but it's now underway. And us on the right path. The first thing you said about having a survey that was impressive gets that Brookhaven name out, and eventually begins to solve what Commissioner Skolnick was talking about, that individuals, not necessarily looking for a hospital referral, but they'll go there and say, we want to go to Brookhaven. Thank you very much.
Thank you very much.
Mr. Snyder?
I'd just like to make a couple of observations. I totally agree. I happen to have had, like Mr. Skolnick, substantial hospital experience as chairman of the nursing board over a number of years, and have faced some of those same problems early on. There are a number of independent nursing homes in the community as well. They are not all
No.
Trinity by any means. Secondly, the coding and the collection is always difficult in this particular county. I'm not sure everybody's totally aware of the impact in this county. This county has the highest acuity of any county in the surrounding area, the highest. It also has the highest Medicaid population of any of the counties in the surrounding area, all of which makes this an extremely difficult position to manage, but by the same token, makes it all the more important that the facility be available. And those are facts. And those are facts that exist today and that existed 10 years ago. The fact of the management is another fact. Thank you.
Gary Sinski?
Two things. Mr. Snyder brings up a good point, is the management. And it's been a concern of mine since that, this board sits on the fiscal responsibility of the Brookhaven, yet there's another board that actually operates it. And I know that's the way it works, but I don't know how to correct that. You know exactly what I'm talking about. And
I have to be careful how I respond.
yeah, I know you do. But I personally have a problem with that. Okay, well, no, I don't.
I could respond to that, Commissioner. In the state of Michigan, that's correct, that there's the Human Services Board that oversees county nursing care facilities. One thing that's different here in Muskegon County, though, than others, is that we do have an agreement. This board has an agreement with the Human Services Board, and so that does allow it allows us some oversight, and it also requires the Brookhaven facility to follow our purchasing and personnel policies, whereas most nursing homes in the state of Michigan are not required to do that. So we do have a relationship, and this board does have some authority over it more than in others areas.
You're still holding back.
That's right.
Thank you for that clarification.
You're my bank.
Yeah,
That's
yeah,
exactly-
okay.
that's how I look at it.
The other issue, and it really doesn't relate to the spreadsheet at all, the county through the share purchases and administers a lot of drugs. You purchase and administer a lot of drugs. I'm just wondering if there's any scale of coordination or any coordination for the administration and the purchase between the two county facilities.
I can't answer that because I don't know what their formulary is. I don't know what drugs they're using, and we've got every individual resident has a set of physician orders that we're required to meet. So I don't know the answer to that question. I know we buy through purchasing cooperatives, and we get the best price we can. And we also have regulatory requirements that may preclude, but I don't know. I can't answer the question. I think it's a good question to look at.
Just a thought.
Sure.
Yeah.
I appreciate that.
Thank you very much.
Thank you.
Keith, I think you did a great job. I just wanted to understand it.
Any other questions, comments?
Move to go back into open session. Second.
Move to second, go back in open session, all in favor say aye.
Aye.
All opposed say no, go back in session. Heard the motion. All in favor of the motion say yes.
Yes.
All opposed say no. Motion carries. WM 12/5-60, administration.
So moved. Second.
That's been moved and seconded. Questions? Seeing none, all in favor say yes.
Yes. Yes.
Opposed say no. Motion carries. WM 12/05-61 for mental health.
So moved.
That's been moved and seconded. Questions? Mr. Jagger?
Why do you increase from 20 to 45,000? I mean, I don't know if it says the scope exactly, or I don't understand it.
I'll defer to the executive director to
The amount, your name and your... Julia Rupp, Executive Director, C. Hold on one second. The estimated cost, that we have an existing contract and they've already done scope of work. We've expanded the scope of work specifically to help us determine what our rates are for services by service code. We have been doing it internally ourselves for a number of years, and I think a reasonable person, including our own internal financial staff as well as Heath, if you look at those services, the amounts for them, they don't make sense, and they don't line up with what other similar organizations would say that fees are for those particular services. So going forward, it's really imperative that we figure out what the real cost per service is, especially with all the changes going on. And Milliman has already worked with us, so we felt like this would be the quickest way and most efficient way in order to get this accomplished in a short period of time. They wouldn't have to come in and rework and learn a lot of things they need to learn in order to be able to do this work for us. So the range, depending on how much time it takes them, it's hard for them to predict, is between 30 and 45,000 on top of the work they've already completed for us.
And then, like how long after you change your rates will this be good then? Usually, I mean.
We have to update our rates every year annually. The truth is, right now, we didn't update them. Now we're into year 2 with the same rates because it would have hurt us to take the rates the way they were. However, once they do this for us, they'll leave us with a work product that then we can update ourselves without having to re-engage them.
So it'll be a few years before we spend this kind of money for an update.
Correct, correct.
Any other questions, Mr. Snyder?
I don't have a question, I just have a comment. It's the same type of thing that we faced with Brookhaven,
It's very simple.
in which coding is, you weren't getting paid for what you were performing. And in order to do this, you need to have someone come in and take an objective view of it, and that's the only way in which you can get your coding to the point where it has real credibility. So, this is something that needs to be done.
Anyone else?
I just have one question. I'm just curious, the funds that, the money to pay for that, is that general fund money or is that grant money?
Probably Medicaid money. We have CMH is in a situation right now because we have 49 vacancies, that if we have money that we're going to send back to the state right now, if we don't spend it.
So none of that is general fund money?
No, none of it is general fund.
Anyone else? Thank you. All in favor of the motion say yes.
Yes.
All opposed say no. Motion carries. WM 12/5-62 from Public Works.
Second.
Moved and seconded. Mr. Jagger.
When they build something, like, they're gonna, let's just say you had a 10-inch duct that we were gonna put in, and then they come along and say, no, it's gonna be changed to a 12-inch duct. Well, they were gonna put something in anyway. Did they deduct for all that before they add on for what they're gonna do? Because it looks like they're gonna plan on doing the whole job where we're gonna do it anyway.
John Warren, Public Works Department. What they were originally going to do is use a smaller pipe, because when this job was designed, what Tower Pinkster did is assume that we were running boiler water at 180 degrees, when in reality our boiler water runs between 140 and 160 degrees. So they had made these pipes too small. What you lack in temperature, you have to make up in volume to move the same amount of heat through there. So what they're having to do here is upsize the pipes, because they have some problems on the second floor with the heat. We don't want to repeat those problems on the first floor. So we're upsizing the pipes right now at this stage of the game before it gets put in and ready to go to alleviate that problem.
I guess what I'm asking for is, does the contractor deduct what he would have had to charge with putting a tent, and for
Yeah,
something smaller?
this is what it costs in addition to what it would have been.
So, and that, is there a way that they figure that in, or is it just, that we have to assume that they're deducting something and then add it back?
In a lot of ways, we have to assume that
Yeah,
there's
assume.
trust them.
Trust and but can't verify, right? Okay.
Wouldn't it be easier to increase the boiler to 180 degrees?
You just had brand new boilers put in to make sure they run lower and more efficient.
Okay.
I remember trying to switch.
180 isn't hot,
Well, when you're running high efficiency boilers, it is hot.
is it? Okay.
Yes.
That's what we're doing.
Is Tower Pinkster covering part of this because they did not catch it in the beginning?
I have presented that to them and asked them to participate with this. I have not heard back from them yet. Because it was a mistake in design.
It was a mistake in design. I won't vote for it unless Tower Pinkster pays for it, so.
Well, I've already sent a request in there.
I realized, I figured you had, John, but that's just, I'm bringing it
This
up.
and a couple of other items also.
They can pay for it.
What else?
You can't hold a project up because you gotta squabble. You gotta get the project done and then squabble afterwards.
Sarah's.
I would just add, that's what we are doing on the first floor. We're making a list of all of the issues as it goes forward. We will deal with the architect and the construction firm when the project's done. We don't want to hold up the project, and so we are keeping track of everything, and we will negotiate with Tower Pinkster as we go forward. But we are, as John said, he's keeping them informed, so they know. I mean, we're sending it that they know, but we're not going to stop and negotiate. So that's why we can't bring it to you right now.
So this will, the final payment will be held up in the end?
Yes.
Okay,
Yes.
that's all I'm on here, thank you.
And we could sue them, and that would be heard in our court, right?
John? All in favor of that motion, say yes.
Yes.
Opposed, say no. Motion carries. Moving on to old business. Anybody got any old business? How about new business? Any new business? Seeing none, time comes for a public comment on a new topic from the audience. Anybody like to speak, please come forward. Seeing none, the motion is in order to. So moved. Order, we're adjourned. Thank you.